Dental hygienist Vanessa Rosas is the first line of defense for her patients at Legacy Dental Care in Baldwin. Rosas compiles medical as well as dental histories. She takes x-rays and performs other diagnostic tests and exams. She performs teeth cleaning procedures to remove tartar buildup and educates patients on proper oral home care. Rosas's career was born out of a need to help others.
I grew up in a very small rural town in southwest Missouri, and we didn't really have very many dental offices close to us. We always had to travel a little bit. So I thought, I want to be someone that can kind of make a difference and have people feel like they matter, like their smile is important, and I wanted to make that happen.
The career of dental hygiene is a wonderful field. It's very overlooked and underappreciated, I think, but it is very, very good field.
Dr. Amanda Darling of Legacy Dental.
I'd like to think I'm the most popular person in the practice, but it's really the hygienists that are the backbone of the practice. That's who spends the most time with the patients. That's the relationships the patients identify with, and they trust the dental hygienist. And I rely on them because they're in their earliest. They're seeing the patient's charts and histories, and they're seeing their x-rays and records, and they are the ones I walk in the room. They download to me what it is I need to be looking for.
Vanessa Rosas is a graduate of the dental hygiene program here at the Forest Park campus of St. Louis Community College. In August of 2019, the program moved into the campus's newly constructed Center for Nursing and Health Sciences.
We actually worked with the architects and the engineers in the design, and they took our concept and just ran with it. And it's more beautiful and more functional than we could have ever imagined.
Kim Polk directs the dental hygiene program. It runs 2 years and combines classroom and laboratory work with hands-on experience in the program's public dental hygiene clinic. Graduates earn an associate in applied science degree and become eligible for board exams to become a registered dental hygienist. Polk, whose mother also graduated from a dental hygiene program, explains the prerequisites.
Our students have to take anatomy and physiology 1 and 2, chemistry and microbiology as prerequisites, and maintain a 3.0 or a B average when they apply to the program. The only other barrier I can think of right now is that there is a lot of demand for dental hygiene education. So in our case, we have a 2-year wait list for students to start the program that have met the qualifications. And so students often ask, what do I do during that time? And my suggestion is that you work as much as you can and save as much money as you can so you don't have to work while you're in the program.
And demand for graduates is high too.
There is quite a shortage not only in the greater St. Louis area, but across the country of dental hygienists. With the onset of the pandemic and then a lot of older hygienists retiring, a lot of younger hygienists having to do child care or homeschooling. There's been a lot of people that have stepped away from the profession for a while, and so there is quite a shortage. Over the course of the last 6 to 9 months, I've had 100 different dental offices contact me, asking me to share their information with our graduates, which I do, via different closed Facebook accounts, so that they could advertise the openings that they have. Barely a week goes by that multiple dentists don't contact me.
Dental hygienists have career paths open to them in addition to working in private dental practices. For example, they're employed in public health clinics. There's mobile dentistry, in which hygienists travel to places like long-term care facilities. Still more opportunities exist in the business sector and in higher education, but some of those options require additional degrees. And continuing her education is definitely on Vanessa Rosas's radar.
I would like to go back to school to get my bachelor's, maybe even teaching eventually, maybe clinically teaching. I think that's on my radar, but it's not a for sure thing. It's just keeping my options open. I'm very happy here and happy with the decision that I made and the accomplishments that I've been able to get up until this moment.
For Living St. Louis, I'm Ruth Ezel.